morning.
Good morning.
My name is Sarah Gergel, and I work with the Living Archives Project, where we are collecting stories of how COVID-19 impacted various communities in Charlotte-Mecklenburg County. Today is April 12th, 2023, and this week there were 30 reported cases of COVID-19 in Charlotte-Mecklenburg County, which shows a 52% decrease over the last 2 weeks. Therefore, each subject is comfortable not wearing a mask. Dr. Strzelecki, would you introduce yourself?
Sure, thank you. So my name is Stephen Strzelecki. I am a 57-year-old white male who is currently sporting a longer hairstyle and facial hair, which is an effect of the pandemic of working from home for a significant period of time and letting my hair grow out and some facial hair. I am a psychologist with Mecklenburg County Criminal Justice Services, where I am the clinical director of the Forensic Evaluations Unit. And so our program works with justice-involved individuals that have significant behavioral health issues. Part of our role is doing evaluations for the court to help determine whether individuals have capacity to proceed to trial. Someone may require a guardian. We do work with the juvenile court system, working with juveniles involved with delinquency court, as well as families involved with dependency court, and conducting evaluations based on the court's needs to get information about capacity to go to trial, parenting abilities, and things like that. The other part that our unit does is even more significant, is behavioral health diversion. So we work with our community partners, our judicial partners, to try to identify, divert, and deflect individuals with significant behavioral health issues from the justice system. And so that could be individuals that are in custody, that are currently in our detention center, to help coordinate services for release that are related to their behavioral health needs, rather than punitive and based on the judicial system. We work with local law enforcement to try to identify people in the community that are at risk of incarceration. So individuals are homeless, have a greater risk of incarceration, as well as being victimized. So work to identify individuals, especially in the uptown Charlotte area, which has historically been the hub for the homeless community, and then work with community providers, advocacy programs to try and address the multiple needs of the individuals and address their social needs and prevent them from being involved with the justice system and incarcerated.
Wow. How long have you been doing that?
So I've been in this role with the county for 10 years, and the position has evolved, which has been fantastic. So it was initially much more focused on the evaluation side. But what we realized as we were doing more and more evaluations, that we were identifying individuals, but then what do we do after that point? And also as a result of changes in the community behavioral health system, we became more of a safety net for the community and provided more and more diversion services, outreach services, really filling the gaps, because we are one of the last stops for individuals in the community.
Wow. So in terms of your experience over the last 3 years, how was your role and department impacted by COVID-19?
Like everyone, significantly. So one of the greatest impairments to our role was the lack of ability to meet with clients. So early during the pandemic, there was no access to anyone who was in detention. So we were not permitted to go into the detention center. We were not even able to access what's called professional visit, which is traditionally what you see through the glass with the telephone. We weren't able to do that because, again, the restrictions for detention, any sort of congregate living setting was paramount at that point. So that was the biggest impairment to our work. The other issue was that because of the pandemic, both the state prisons and local detention centers, ours included, were releasing people quickly to reduce the population because they were at risk of COVID in that setting. This is obviously pre-vaccination. So in addition to not being able to meet with people and track them, the more were being released, and we were trying to follow up and identify them without having the planning that normally would have been in place if things were being done how they were traditionally. So those were the first, I think, the two biggest concerns or factors that we ran into. But like everyone else, we sort of adapted and made changes over time.
What are some of those changes?
So we became much more of an outreach program. So we, and which has continued since then, even in terms of going out to meet with clients, finding them, getting referrals from police officers, and meeting them where they were. And oftentimes that was in the community, it could be on the streets, or if they had housing, outside their residence in an open air setting, and to do whatever we need to do, whether it was help them fill out disability paperwork, or we actually get mail for a lot of our clients that don't have stable housing. And so if they have important documentations, they're mailed to our office. So we would meet up and give them that. Move individuals from one housing location to another, that there were like motels set up for the over 60 population and things like that. So we really just started picking up the pieces, so to speak, and going out and doing what we could. And the other area that was really a game changer and a really simple thing that we did more on a system-wide basis in our department was the use of cell phones.
Okay.
And it has, so we historically we have some funding within our department working with some of our most vulnerable high-risk individuals to purchase a prepaid cell phone and a way of connecting with them. Mm-hmm. But as a department, we invested both initially with our own funds and then through the federal grants, ARPA funding and things like that, to purchase bulk orders of cell phones so that we could stay connected with clients when we couldn't physically meet with them. Yeah. But we needed to stay in touch with them, and they needed that to stay in touch with their providers and their support network. So doctors' offices went remote, so you had to call in and talk to your doctor. Yeah. If you didn't have a phone, you couldn't call into your doctor. And so you couldn't make appointments, you couldn't connect with folks. And so that was something that we started in 2020 and have continued to this time. And it really is helped. I don't say this is not post-pandemic, but as in this new reduced COVID rates, still doing that with clients that don't have access to communication. It's an investment that is, from our standpoint, it allows us to stay in touch with them, meet their needs. They can reach out to us and reduce crises, can reduce rearrest because now we can connect them with services and they can follow up with individuals because they have that cell phone. And it's a really, I think for $20 or $30 a cell phone, it is a phenomenal investment in terms of being able to work with clients that otherwise were very difficult to track down and follow because they didn't have the resources. Yeah.
How do you feel that the clients you worked with responded to those services, like getting a cell phone or the other the adaptations that you guys were able to make?
Yeah, I think so. Again, not just the cell phones didn't just benefit our work with them, but it really allowed them to, call their family or try and find other resources and connect with others. So it really gave them a connection to the world that otherwise wasn't available. And we had actually looked at one point, sort of how we invested in this is the availability of pay telephones in Uptown Charlotte. And there are none. There really aren't. I mean, most of us don't think about that these days. But there really was no other way. And because of the COVID restrictions, people couldn't go into a business or to use a phone that just wasn't available. So without public pay phones and or other places to make those calls, they really were even more isolated. So it really has helped. And it, to this day, still continues because we can, just call someone up or trying to get in touch with them based on the cell phone that they have available. And then they can do that for other areas in their life.
Yeah, that's amazing. That's an amazing way that the county was able to really provide a need that was critical.
Yeah, and I think that, I've heard criticisms in the community of, seeing an individual that's homeless or has insecure housing having a cell phone as well, if they have a cell phone. But they're not that expensive. And two, it is the lifeline connection these days for everyone. That's how you get in touch with your child's school or have to schedule an appointment to get for your car or whatever. Everything has to be done with a phone or online. And without a smartphone or a way to call, you are just disconnected from the rest of the community.
Yeah, 100%. You also mentioned that you worked with correct me if I'm wrong, but you mentioned that you work with rehousing or relocating.
So our department does a lot of work with individuals that are coming out of incarceration. Okay. And so actually we have one of our department programs is reentry. So they really focus on reentry from individuals coming out of state and federal prison, returning to the community. But the the higher numbers are folks that are arrested and then just released from our local detention center. And that's because they're arrested, most are pretrial. So they're charged, they're arrested and then are released based on bond or the conditions of release. Those happen in much higher numbers than folks return from the prison system. And then again, during the pandemic, those things were happening much quicker and faster. And at the same time, and I was thinking back about 2020, which was when this all happened, was also the period of the social justice movement was really becoming evident in Charlotte. Sleepy Charlotte, North Carolina, so to speak, was very powerful and very important because some of that was from the George Floyd death, and it sparked. There were protests. There was a jail. It was initially a jail support program, so people sitting outside the detention center, handing out water and snacks as people were being released because they had been arrested during the protest, and that grew. It grew into a movement, and even from that sprung some advocacy programs and groups that we still work with. So they had started as this sort of support program, but have grown into nonprofit organizations. They are doing work with individuals that are marginalized and justice involved, and working on an array of trying to connect them with services, jobs, and things like that. So it really sort of fosters some grassroots connections. And in a sense, oftentimes people were protesting against what were inequities and there were injustices, but also working with us to make changes in the system and address the needs of the individuals that they really were seeking to help. And so we have developed partnerships since then and continue to work with some of these organizations as partners as we try to find niches for housing or supported employment or things like that.
Mm-hmm. So do you find that during the pandemic and in response to the pandemic that the county and the department you work in, with these relationships you started to make, the capacity building with these organizations, do you find that partnerships and resources were strengthened during that time?
Well, I think the connections were strengthened. There's still a lack of resources, and I think if nothing else, the pandemic highlighted the gaps in services, the inadequacies, individuals that were sort of struggling pre-pandemic, it became even more significant. So, like, for example, affordable housing and availability of housing has been an issue in our community for years, but we have seen that grow over the past few years, as well as people who are struggling in terms of employment may have lost jobs. And so they were really living on the edge, so to speak, and then as a result of changes in the economy, their jobs went away, or they weren't able to work because it was they're working in a restaurant, and for months, restaurants were really closed or just doing minimal work. And so it really, I think the relationships are stronger in some ways, but we've seen where there are gaps, and the lack of services has really impacted some of our individuals significantly. They have struggled more during the pandemic, and even a couple years in, because of the lack of continuity that they had pre-pandemic. So it has helped in some ways, and I think it has also, if there's an improvement, there is, I believe, in some areas, a greater compassion or empathy or understanding that because in a sense we've all gone through this together, and to have a little more patience with whatever the system, there's the great resignation, and there's shortage of staffs, and I know in our arena in particular, for therapists and nurses and healthcare providers, there's a greater need than there are staff available, and so we're trying to all deal with that and fill in the gaps as we can, but also understand that this, we just need to be a little more patient and to each other. A little more understanding. By the same token, we've also seen the isolation has caused more distress for some folks, and I think we see that in some of the, I think across the nation, some of the shootings, some of the sort of some social aggression and violence that is really that's a manifestation or exacerbation of what may have been there before that the pandemic impacted.
Yeah, well, thank you for that. Thank you for sharing. Before we started your interview, we did an activity together called a hand map. I'm just going to give you yours in case you want to refer to it. Is there anything from your hand map that you would like to share?
Sure. I think so. One of my journeys is my professional career, and so my formal training is in clinical neuropsychology, and so I had worked here in Charlotte at the rehabilitation hospital, and that role is what really got me into forensic psychology, doing evaluations that then got connected with individuals that were court involved. And over the last few years, I mentioned in terms of our work, our unit has evolved, but I think in particular, because of the pandemic, we've been much more proactive in our work. And I think that I much rather talk about that work than just the evaluations. The evaluations are important, it gives us information, but changing people's lives, trying to help individuals that have been struggling is really the thing that I like. At a party and someone asks what I do, I explain it, and that's what I start talking about. We started a program. It's called SOAR, S-O-A-R. It's SSI, SSDI, Outreach, Access, and Recovery. And it's a program through SAMHSA, which is the federal government's Substance Abuse Mental Health Services Administration, as a way of expediting applications for disability. And so it's really more of a process that's the program. But so we have a SOAR program. And it has grown over the years because what we were finding, obviously, is that there were a great number of the individuals we were working with, both those coming out of prison and our local detention center, are qualified for disability, but the application process is fairly arduous. For someone who is struggling to even do that on their own is really next to impossible. And we have a full-time person and a part-time person in our department that do that, and it's makes it different for folks, especially since we don't have Medicaid expansion yet. It allows them to get access to healthcare insurance, supplemental, food benefits, other social supports, as well as a limited monthly income. But that's housing for individuals. Now they have some funding for that. So those kinds of things have grown over the past couple of years during the pandemic. And as my role as a psychologist in my career, being a much broader impact in terms of making a difference in people's lives, and especially during the pandemic where we really saw folks were struggling.
Yeah. Wow. Those resources in that program sound like it really meets a need that is still impacting today.
Absolutely. It's still there. And then, the other thing, I look at my people who've influenced me. Certainly I have family members, but I also have people I know professionally, because I think some of those connections were really became more important, in terms of both my working with them work with me, and us having sort of a shared journey of addressing what we see as the bigger needs in the community. Yeah. So I think that this past few years certainly has been the case because of, so much time people were in lockdown, and so to speak, with family members, and the roles that we played in supporting each other and just going through this together. And then professionally with individuals that I know and work with, that the work we share for the community.
Mm-hmm. So as you reflect back over the last 2-3 years, on a personal note, how did you see yourself personally impacted and your family impacted?
So I will say, and from even our little pre-discussion, I recognize I live a very comfortable life, and I'm thankful for that. And so I know that I continued to work during the pandemic, and as did my wife. My children were in school, and they had made some adjustments, but they were older, so in graduating high school and into college. So I know friends, colleagues, others had greater struggles in terms of trying to educate 3 children at home in elementary school during the pandemic, and as well as folks losing their jobs, losing family members. So the impact is recognizing that in others, and certainly carrying that with me when I'm every day at work, or every day when I'm working with people, understanding that I'm here, I'm doing what I can to help individuals, support them, to get access to what care they need. That for me was understanding that I can play that role, and I'm grateful that I have that opportunity to do that because of the position I'm in.
Yeah. Well, thank you so much. Is there anything, as you reflect upon the last few years, is there anything, an experience or a story, either at work or your personal life, that stands out to you?
So yeah, I'll say one in particular, and this was fairly early on in the pandemic. It was our relationship with local police department, CMPD, had identified an older individual who was living in the North Tryon area. And the officer reached out to us because they had concerns about this individual's just their well-being and their welfare. It was during the pandemic. They were living outside. It was cold in the winter, and so we started. They located the person, called us, and we met up together. And then we started working with this individual, literally meeting in like a Walmart parking lot with the minivan to fill out the application for disability for this person, to try to get them the services. And it took a while because that's how it is with Social Security, even with our experts involved, but got that for him and got him into a housing. He went to one of those 60-year-old or older motels for stability, and just the sort of the individual pieces of the puzzle, the people who noticed this and would made the call and get the connections to help this one person that they saw was in distress. And it really, it really shows that it is that still we're relationship-based community, and certainly our work is. And having those partners that, even though people, it's law enforcement, but they are looking out for individuals' well-being and can make a call and make a connection, and how this sort of snowballs, and how that many people coming together to help individuals in our community.
That's a beautiful story. Thank you for sharing.
You're welcome. It really was. Sort of highlights, sitting, everyone's masked up, in gloves on, windows open, trying to do these what we normally do in our office, but didn't have that available. Mm-hmm. So we were doing it in whatever way we could.
Yeah, that's amazing. Before we end our time together, is there anything else that you would like to share with us?
So, I think one of the things I wrote in somewhere is the new normal. And I think, it's a phrase, but I really do think, we've seen some return to things that we were doing before, but I don't think we'll ever be exactly the same. In some ways, that's good. Again, we're doing a lot more remote things. We're able to connect with people easier and have that ability now, and trying to leverage technology and other services. But I think that it's a real difficulty, because the struggle is that these changes happen in such a short period of time that we're still, we had done things one way. It's not that we can't change and adapt, but there's so much happening at one time. So recognizing that as people come in and they have appointments or anything, I would say even, I was telling this to my colleagues, I took my dog to the vet, and it was just a longer wait because they were short vet techs, and understanding that I'm thankful to have that service available, and understand that there are going to be some changes, and this just to be able to accept those things and carry that through the work we do, and understand that everything's not going to be as quick and as easy as it might have been before, and to sort of accept that.
Mm-hmm. Well, thank you. That's so very true in all areas, really. Thank you so much for your time today. Thank you for sharing your story with us, and especially your work experience over the last few years. Really appreciate it.
You're welcome. Thank you.